What causes a micropenis? Can it be treated? What if a man is born with a penis that is much smaller than normal? Is it because of bad genes, low testosterone? Did something happen during pregnancy? Can it be treated? And is size the same thing as sexual ability? Today, we are going to answer these questions using urology, sexology, biology, genetics, endocrinology, and sex psychology with simple language that anyone can understand. What is a micropenis? First, let's understand something very important. A micropenis is not simply a penis that looks small. In medicine, it has a very specific definition. Doctors measure the penis while it is fully strength, called strength panel rank SPL. A penis is considered a micropenis when its strength rank is more than 2.5 standard deviation below the average for age, while the penis itself is otherwise normal formed. That means many men who believe they have a micropenis actually do not. Sometimes the penis only appears small because of obesity, a large fat pad around the public area, body shape, visual comparison with pornography, anxiety. This is one reason why proper medical measurement is important. What is average penis size? Many people ask. So, what is normal? Research involving tens of thousands of men from many countries shows that race is not the main factor determining penis size. Average measurements in adults are approximately flaccid length about 8 to 10 cm, 3.1 to 3.9 inches, stretch length about 12 to 13 cm, 4.7 to 5.1 inches, erect length around 13 to 14 cm, 5.1 to 5.5 inches, average erect circumference girth around 11 to 12 cm, 4.3 to 4.7 inches. There is natural variation. Some healthy men are smaller, some are larger. Both can be completely normal. What causes a micropenis? Let's look at the biology. 1. Low testosterone before birth. This is one of the most common causes. During pregnancy, a baby boy needs enough testosterone at specific stages of development. If testosterone is too low during those critical weeks, the penis may not grow normally. Example, imagine building a house. If construction materials do not arrive during the important building phase, finishing the house later becomes much harder. The same principle applies to fetal development to problems with hormones. Sometimes the testes can produce testosterone, but the brain does not send enough signals. Two important hormones are LH and FSH. These hormones tell the testes to produce testosterone. If these signals are missing, penile growth may be reduced. 3. The body cannot respond to testosterone. Sometimes testosterone levels are completely normal. The problem is that the body cells cannot respond properly. This is similar to having a key that fits the lock, but the lock is broken. The hormone is present. The message simply isn't received. 4. Genetic conditions. Certain genetic differences may affect genital development. Examples include abnormalities involving chromosomes, androgen receptor, androgen receptors, hormone production pathways. These conditions are uncommon but important. Doctors sometimes recommend genetic testing when appropriate for problems with the pituitary pituitary gland. The pituitary gland is often called the master gland. It controls many hormones in the body. If it does not function properly during infancy or childhood, testosterone production may also be affected. Does anything during pregnancy increase risk? Research suggests some factors may increase risk, although many cases occur without any obvious reason. Possible factors include certain hormonal disorders, rare genetic mutations, severe fetal hormone deficiencies, disorders affecting testicular development. It is important to remember parents usually did not cause this. Many causes happen naturally during development. Does a micropenis affect urination? Usually no. Most boys and men with a micropenis can urinate normally. The urinary opening is generally in the correct position. If there are additional birth differences, treatment depends on the specific condition. Does it affect fertility? Not always. Fertility depends much more on healthy testes, sperm production, hormone levels. Some men with a micropenis produce normal sperm. Others may have fertility problems if the underlying hormonal disorder also affects the testes. Every case is different. Can someone have normal erections? Yes, many men with a micropenis can still become aroused, have erections, experience orgasm, ejaculate, size, and erectile function are not the same thing. Does penis size determine sexual satisfaction? According to sexology research, not necessarily sexual satisfaction, involves many factors: communication, emotional connection, foreplay, confidence, technique, mutual understanding, overall relationship quality. Many couples report satisfying sex without unusual large penis size. Can it be treated? Yes. Treatment depends on the cause and the person's age. Treatment during infancy and childhood. If hormone deficiency is diagnosed early, doctors may prescribe carefully monitored testosterone therapy in some children. This can significantly improve penile growth. The earlier treatment begins, the greater the potential benefit. This is why early diagnosis matters. Treatment during childhood, if puberty is complete, additional growth is usually limited. However, doctors may still evaluate hormone levels. If testosterone deficiency exists, appropriate hormone replacement may improve energy, bone health, muscle mass, sexual desire, erectile function, but hormone therapy will not dramatically enlarge a normally developed adult penis. Surgery is reserved for selected situations. It is not appropriate for everyone. Benefits and risks must be carefully discussed with experienced urologists. What about pills, oils, creams, and online products? This is where many men lose money. There is no strong scientific evidence that herbal pills, enlargement creams, oils, patches, magnets, massage devices alone can permanently increase penis size. Many advertisements use unrealistic promises. Some products may even be dangerous. Practical advice from me: if you believe your penis is unusual small, don't diagnose yourself. Instead, step 1: measure correctly using the stretch penile length method. Step 2: see a urologist if you are concerned. Step 3: ask whether hormone testing is appropriate. Step 4: if needed, request evaluation by an endocrinologist. Step 5: avoid buying expensive products without medical evidence. These 5 steps can save money, reduce anxiety, and help you get accurate information. What can you apply today? If you are a parent, pay attention to normal genital development during infancy. Routine pediatric checkups are important. If you are an adult, remember that comparison is often misleading. Pornography uses camera angles, selective casting, writing, and editing. These images do not represent the average man. If anxiety about penis size is affecting your confidence and relationships, talk with a healthcare professional rather than relying on internet myths. Benefits you can gain from me after understanding today's topic. You should be able to understand what a true micropenis is, know the average penis length and circumference, recognize the role of hormones and genetics, understand that fertility and erection are different from size, avoid scams that promise unrealistic enlargement, know when to seek medical evaluation, make health decisions based on evidence instead of fear. My opponent, in my opinion, one of the biggest problems today is not biology, is misinformation. Many healthy men believe they have a medical condition simply because they compare themselves with unrealistic images online. Real confidence starts with accurate knowledge, not comparison. My advice, if you're worried about your penis size, don't let embarrassment stop you from seeing a doctor. Urologists discuss these concerns every day. The sooner you get reliable information, the sooner you stop guessing. Knowledge is always more powerful than fear. My final thought, a micropenis is a real medical condition, but it is also uncommon. Most men who worry about having one actually fall within the normal range. The normal range. Instead of chasing miracle products, invest in accurate diagnosis, evidence-based treatment, and a healthy understanding of your own body. The goal is not to become someone else. The goal is to understand your body, protect your health, and make informed decisions from the rest of your life. Thank you very much.